So the Children's Hospital of Boston they're kind of a pioneer in that they have this forward thinking and everyone's bought into this personalized medicine and they're changing the way that people deliver healthcare. How can we take that model and apply it to other organizations who are kind of, a little bit hesitant to do the same thing?
So the way I would characterize this new and evolving field that we helped set in motion back in 2005, 2006 is that navigenics really was the disruptive force for change. We're slowly starting to see the early adopters now in mainstream medicine come on board. Children's Hospital Boston being the first flare in that direction, where we're really starting to see that type of disruptive innovation go mainstream. The problem now, or the challenge now for us as a community, is scaling that not only across other pediatric institutions, but the community-based healthcare setting. And remember, 80% of care in both adult and pediatrics is in the community-based setting. And really getting new technologies ingrained in those settings is going to be the key to really truly transformational change in outcomes. But perhaps more importantly, a solution to the economic crisis we're facing with respect to the burden of genetic disease, chronic complex genetic disease nationally. So one of the keys is physician education. The other is really making providers cognizant that they will be responsible for a portion of healthcare costs based on, for example, readmission rates 30 days after prescriptions, and that brings into play the whole notion of pharmacogenomic testing to reduce adverse events from drugs like warfarin and Plavix. Wonderful New England Journal of Medicine paper a couple months ago on that topic. Really engaging providers together with payers to realize that this stuff does save money, and be a little forward thinking in the application of it. Secondly, I think there's a huge opportunity for the private sector, and that's where I'm spending 100% of my effort right now, in building a turnkey solution for delivering the genome and delivering clinical grade interpretations of that genome to physicians so that patients may benefit and providers and payers may reap the economic benefits of that. And so I think there's a private sector solution, and that's where we're focusing all of our efforts today.